I was really in need of someone to listen to the situation with me and begin to make sense of it with me rather than in their own mind. I needed to start to make sense of that in my mind. And that was something that was so impressive when we met for the first time. You were there with prepared questions to lead the physician, not just the physician leading us in the conversation, but you were leading the physician. And I always felt that you were doing that knowing what I needed to hear. And that was so critical for me. Yeah, that's what I wanted to ask, but I would have not gotten to it. But you got to it. But to have someone, an organization, a couple of people who can then sit down with you after the visit or before the visit, but after the visit, especially, and say, "Did you hear that about so and so? Well, here's what he's talking about. Here's what she is suggesting. Wow, is that what really that's what the conversation was about? I didn't get that while I was in that stuff is critical for me. I need to see the bridges. Need to see the connection between things. And I don't always get it when I am there sitting listening to the physician as they go through their view of things. And that was critical at that point to understand clearly what was going on in my body. And I really appreciated having time to ask questions, ask you to go back over something, and that was amazing. I discuss about the selection of a hospital, a place to have all this work done. She said, "We're going to ask," and notice she said, "We're going to ask," because she was going to be with us along this whole path. We're going to ask about the success rate. We're going to find out how good they are with their patients. I thought, yeah, what else do we need to know? So, uh, one of the places that Cindy suggested we consider was Duke University. So, lo and behold, Cindy got in contact with us a few days later, and she said she made an appointment with the doctor who is the head of the surgical staff that deals most often with the kind of procedure that I'm going to be facing. And I thought, whoa, as a patient, I'm sure I'm not going to get that call. If I call Duke and say, hey, I need a doctor, I'm going to get a doctor. It's going to be a pretty darn good doctor, but not the head of the staff that does that kind of work.